Thank you for joining us here this evening. I'm Michelle Deatrick, Chair and founder of the DNC Environment and Climate Crisis Council. The Council was founded in August 2019 to ensure that the National Democratic Party takes bold, ambitious action on the climate crisis. Now we're in the middle of dual crises, the climate crisis and the COVID-19 crisis. The impacts of both are felt everywhere in America. The DNC Environment and Climate Crisis Council has talked with people across the country about the impacts of climate change. We've talked with people who've lost their homes to California wildfires, to people in the Southwest dealing with extreme heat events and drought, to people worried about losing coastal cities in the Southeast, and more. The climate crisis is experienced differently everywhere, but everywhere we go, there's agreement that we face a climate emergency and that the nation needs to rise to the challenge of tackling it. There are some striking similarities between the climate crisis and the COVID-19 crisis, and there are lessons we can learn from the pandemic to help us address the climate emergency. With me here today to talk about those lessons is Dr. Linda Rudolph. Dr. Rudolph works with many health and medical organizations to support policies that address the health threats of the climate crisis and health inequities. She previously served as director of the Center for Climate Change and Health at the Public Health Institute, as director for chronic disease prevention and health promotion in the California Department of Public Health, and as the health officer and director of public health for a small local health jurisdiction, which I especially appreciate as a former county commissioner. Dr. Rudolph currently serves as vice chair of the DNC Environment and Climate Crisis Platform Committee. Thank you for being here with me today, Dr. Rudolph.
Thank you, Michelle. I really appreciate that you're hosting this discussion.
Well, it's an important one, and I can't think of anyone I would rather be talking about it with you. So let's just dive right into a conversation. And I do want to remind watchers that we are taking questions. So if you post a question in response to the Facebook Live, we will be taking them later in the conversation. Linda, given the severity of the COVID-19 pandemic, it's reasonable to wonder why we should worry right now about the climate crisis and its health impacts. Can you talk about some of the public health impacts of the climate crisis here in the United States?
Sure, and we are definitely facing a health crisis right now that's unprecedented in our lifetimes, and it's having profound effects on our health and on our daily lives and on the economy. And I just want to start by saying how grateful I am to my public health and healthcare colleagues and all the other essential workers that are putting their own health at risk to deal with this pandemic. And it's completely appropriate that many people are making it center stage right now. So your question is a good one. In the midst of one health crisis, why should we focus on another looming health emergency? And I feel that the threat of the climate health emergency, while it's unfolding more slowly than the COVID-19 pandemic, is really no less of a threat to our health and well-being. And because we need to take action so quickly on climate change, we don't actually have the luxury to ignore the climate health emergency, even as we're struggling to cope with the pandemic. At its most basic, the climate crisis threatens the very things that we depend on for our survival. It threatens our air, threatens our water, our food, our shelter, our security. And that's why last year, about 150 health and medical organizations issued a call to action on climate health and equity. And these organizations that represent millions of doctors, nurses, and public health professionals said, yes, climate change is a true health emergency, and it's one of the greatest challenges to our health of this century. And that statement is true even in the midst of the COVID-19 pandemic. We're actually already seeing many of the climate health impacts now, and we know that without action to reduce climate pollution, those will only get far worse. Some of the impacts are direct. There's climate-related floods or extreme storms that cause acute injury and death or displace people from their homes. There's extreme heat that actually kills more people than any other climate-related disaster already. So, for example, in California in 2006, we had a really bad heat wave and there was more than 650 excess deaths. But in Europe in 2003, there was more than 70,000 excess deaths from a heat wave. Some of the impacts are less direct. So when we have warmer temperatures, we get higher levels of ozone, which is a key component of smog, and that worsens asthma. We also know that heat and climate-related drought create longer wildfire seasons and more extreme wildfires. And wildfires create these huge smoke plumes that can travel many, many hundreds of miles, and they're just laden with particulate matter. And that particulate matter exacerbates asthma, it increases the risk of heart attacks, and it causes premature death in people that already have heart and lung disease. The climate crisis impacts our food. It decreases the nutritional quality of many crops. Extreme events of all sorts lower crop yields, and that increases food prices. And we have so many people already in the US that are facing food insecurity. And when food prices increase, that increases food insecurity. And we're seeing how many people are confronting food insecurity now during the COVID epidemic. We don't want climate change to make that even worse. Climate change increases the risk for food poisoning and the risk for tick and mosquito-borne disease. And we're seeing those diseases in communities that have never seen them before. And not surprisingly, all these other things have mental health impacts. People have PTSD or post-traumatic stress disorder after big events. A lot of young people are expressing a lot of anxiety about what their future will look like because of the impacts of climate change. And one last thing is that these climate-related health impacts are extremely costly. So if we look at the health care costs and the health-related costs of just 10 climate-related extreme weather events, in 1 year, the costs were about $10 billion. So that's another reason for concern, given how expensive and how much of our economy already goes into supporting healthcare.
Thank you. And that really leads into the next question I have, which is about the fact that we know that the pandemic has had a disproportionate impact on frontline and vulnerable communities, with the death rate for African Americans and the Latinx community far exceeding that for the rest of the population. So we know that part of the reason is air quality, which you touched on in relationship to the climate crisis, but there are many other reasons as well. And could you talk about how the climate crisis is inequitably affects Black, Brown, and Indigenous people?
Yeah, so I think the most important starting point is that, you know, as people have become more aware of with the COVID-19 inequities, people of color and people in low-income communities start with much shorter life expectancy and much higher risks for chronic illness and for injuries than others. And in public health, we often say that we can forecast your life expectancy just by knowing your zip code. What the climate crisis does is exacerbates these stark, very long-standing and really unacceptable health inequities, much in the same way as COVID-19 is doing. So you're absolutely right. Air pollution is a very important reason. People of color are more likely than others to live near oil refineries or other industrial facilities and near busy roadways and freeways. So they have much higher levels of exposure to air pollution. And the sources of air pollution, which is primarily fossil fuel combustion, are also the causes of climate pollution. And air pollution increases the risk for asthma, for chronic respiratory disease, for heart disease, and for diabetes. And those chronic illnesses all make people more vulnerable to many of the climate health impacts that I just mentioned, much in the same way as those illnesses make people more vulnerable to really bad outcomes from COVID-19. And I will note that about 200,000 people in the US die prematurely from air pollution every year in the US. But there's a lot of other reasons as well. Just for example, renters or people that are living in poverty, many of whom are people of color because of historical marginalization and discrimination, are much less likely to have insurance. My family lost our family home in the 2017 wildfires in Northern California, and we're blessed to have good insurance and financial resources. If you don't have that, you can't recover from these extreme events. And as an example, after Hurricane Katrina, New Orleans lost a very large proportion of its African-American community because people simply couldn't afford to go home and start over again. In rural communities, poor rural communities, there's a much higher risk from drought impacts, especially tribal communities where many already lack access to clean drinking water. And we know that drought increases toxic contamination in water. And here in California, in our last drought, people in these poor rural communities, primarily Latinx communities, lost access to any kind of water because their wells ran dry. Think about how that increases the risk in a pandemic as well, when hand washing is so important. People that live in poor quality housing are more likely to have asthma, so they're more at risk from ozone and wildfire smoke. Low-income families can't adjust their food budgets when food prices go up. The list goes on and on. So in almost every way, climate change exacerbates existing health inequities that largely impact Black, Latinx, and Indigenous communities.
And we have a question from Natasha, which relates to exactly what you've been talking about, Linda, when you touched on the issue of the hurricanes and how the impact. Natasha asks, as we are approaching an intense hurricane season, what does this mean in the age of COVID-19? Good question, Natasha.
That's a great question, Natasha. And of course, all of these extreme events, wildfires, hurricanes, floods, cause a lot of people to lose their homes and to be at least temporarily evacuated. And how that's going to work when we're trying to keep people at a distance, or how first responders are going to be able to help people when we're trying to physically distance from each other, it's going to be a big challenge. And the other challenge is that the COVID-19 pandemic is interfering with the activities that would normally be taking place to prepare for these climate events. So one of my daughters is a forester who was working for CAL FIRE, which does fire prevention in California. And they had to close their fire camp where they train people to respond to firefighters because of the pandemic. So these things are interrelated in many ways. And Natasha's question just really points out one more of those.
Well, so turning to preparation, we know COVID-19 has also impacted other groups of people, particularly elders, people with disabilities disproportionately, people with asthma, but people with other disabilities as well. So what about the climate crisis? How will it impact elders, people with disabilities? And are there ways that we can prepare our communities to be more resilient, more ready?
Yes and yes. The very young, the very old, people with both cognitive and physical disabilities are all at a disadvantage and more vulnerable to these climate health impacts. They're more vulnerable to heat illness. People that have diabetes are more vulnerable to heat. People that take certain kinds of medications, especially some of the more common psychiatric medications, are at higher heat risk. Homeless people, people that are outdoor workers are all at risk for heat and also for poor air quality and tick or mosquito-borne disease. One of the things that really makes me so hopeful about climate change and our ability to address it, though, is that the best way to create a climate resilient community and to stop climate pollution is to create a healthy community. Most of the climate solutions that we're aware of are also health solutions. So when we take action to prevent climate pollution, we can see very significant and very rapid health benefits. We talked about burning fossil fuels being a major contributor to climate pollution. If we switch to clean and renewable energy to power our homes and our vehicles, we can reduce the heart disease and lung disease and adverse reproductive outcomes that are associated with air pollution at the same time that we're reducing climate pollution. We know that many chronic diseases are contributed to by a combination of poor diet and insufficient physical activity. Well, when we make it easy for people to get to school and work by walking and biking and using public transit, we not only reduce carbon pollution, but we also reduce heart disease, obesity, diabetes, osteoporosis, and we improve mental health. And the same thing with creating more sustainable local food systems that give people better access to affordable plant-based diet. We reduce diabetes, obesity, and heart disease. But it's also really important that we build our communities so that we protect against climate disasters. So we can make more parks and create better tree canopy and build our buildings with cool roofs to protect from urban heat islands. And we can also use green infrastructure and rainwater capture to help with stormwater runoff. These are all things that will also make our communities healthier and more pleasant for people to live in while we address the climate crisis.
Mm-hmm. Absolutely. And I'm so glad you brought up green space. I think a lot about how having access to green space is a good for our physical health, for our bodies, and for our minds. And it's in a key component of the picture. I just want to mention that, you know, in the months leading up to the pandemic, we had 30 million Americans who didn't have health insurance. At least a third of those, depends on the poll, report avoiding treatment due to cost. We've got a projected 6, maybe 7 million more projected to lose health insurance coverage because unemployment is skyrocketing and their health insurance is linked to their employment. And this is really striking and terrible. Nearly 70% say their out-of-pocket costs are important to the decision to seek care if they have COVID symptoms. I feel like this pandemic is shining a stark light on some real problems with the US healthcare system. And what do you see as the answers for what changes we need to make for being ready for any crisis, COVID-19, climate crisis, hurricanes?
Well, we clearly need to have a system where everyone has access to the healthcare that they need.
That may have been a leading question, but yes, I agree.
Yeah, I mean, you know, we can't live in a country where we have tens of millions of people that don't have access to healthcare. And I think that COVID-19 really demonstrates the importance that has, not just for the people that don't have health insurance, but for all the rest of us. You know, COVID, if it shows anything, shows that we are all in this together. You know, we can't have a group of people who don't have health care and so they continue to spread disease. And the same thing with other things that other industrialized nations provide for the people that live in them, like paid sick leave. It really matters that people are economically able to stay home when they're sick, when we're facing something like COVID. But it's just as true for preventing, you know, foodborne illness. If somebody's sick, they need to be able to stay home. So I think COVID is showing us how much we're tied together in our health. But these other things as well are super important that we've learned. I think we've learned or are showing us so strongly in the pandemic. For one thing, facts matter and science matters. Scientists have actually been warning us about the risks of a pandemic for a long time. And we had a period of time when there was more funding for pandemic preparedness. Actually, when I was a local health officer, we did a lot of work on both pandemic preparedness and bioterrorism preparedness. A lot of that money has gone away because we had the H5N1 epidemic, and then it went away and people were like, oh, that's all done. Well, the same thing is happening now with climate change. Scientists have been telling us, the facts are showing us that it's happening, that the climate crisis is upon us, and that we need to respond with great urgency. We need to be acting really quickly to prevent a totally catastrophic climate crisis, and we're not responding. So I hope people come, when we emerge from the immediate crisis of the pandemic, think about how important it is that we pay attention to the warnings and that we take early action. We missed a really important window of opportunity to contain COVID-19. We have a similar short window of opportunity now to reduce climate pollution and avert catastrophic climate chaos. Let's take advantage of that window of opportunity and take the early action that we need. I think COVID also shows us that in addition to addressing the big, gaps in our healthcare system, we have big gaps in our public health system. Local and state health departments have been underfunded for years. Public health labs have been underfunded for years, and we really need to rebuild our public health infrastructure. You can't fight a public health crisis without a robust public health infrastructure. And that's true for COVID, but it's equally true for responding adequately to the increasingly severe climate-related disasters that we're seeing. It's our local public health systems that staff the evacuation shelters, that provide care in those shelters. So, there's so much that we could be learning. And I just want to come back to this issue about the need to really redress the underlying health and economic inequities that compound the harms in the face of either an infectious disease crisis or the climate crisis. I think it's incumbent on us, when we're about to invest trillions of taxpayer dollars to rebuild our economy, that we think very hard about how can we build back better? How can we use those dollars to invest in our most disadvantaged communities and build communities that are healthy and equitable and sustainable and resilient in the face of the next looming crisis, which is the climate crisis. And we can do that in a way, as I just said, that addresses climate pollution and brings very immediate health benefits.
I mean, it's a crisis and a terrible tragedy, but there's also an opportunity to respond in a way that helps make the next crisis, the larger climate crisis, but also the many, many crises associated with and caused by it, the hurricanes, the wildfires, the flooded farmers' fields, at least make us more resilient and more ready to deal with them. Thank you for that. For those of you just joining us, I'm Michelle Deatrick, Chair and founder of the DNC Environment and Climate Crisis Council, and I'm joined here today with Dr. Linda Rudolph, who works with, she's a public health expert who works with health and medical organizations to support policies that address the health threats of the climate crisis and health inequities. She's served in many roles, including as Deputy Director for Chronic Disease Prevention and Health Promotion in the California Department of Public Health. And she is currently also serving as Vice Chair of the DNC Environment and Climate Crisis Council's Platform Committee. I also want to remind you that we are taking audience questions. So if you want to respond to our Facebook Live with a question, we'll do our best to fit that in. And I have a question right now from Jeremiah from Maryland. And Jeremiah asks, how can we counter the increased demand for disposable and single-use goods as a result of contagion fears? which just reminds me, I'll let Dr. Rudolph answer in a minute, but it really reminds me of how interconnected everything is that we do. So yeah, Linda, do you have some thoughts about that?
I think it's a really good question, and I'm not sure I have the answer to it. I think that, most of our plastics and disposable wares are produced from fossil fuels. And so we know that moving toward a less disposable economy is very important from the perspective of both toxics pollution, plastics pollution in the ocean, and climate change. But I don't have a good answer for you, Jeremiah. And I would refer you to the Healthcare Without Harm website, where they have a lot of information about COVID and also about the use of plastics and other toxics in the healthcare environment. And if there's any place that might have some suggestions on that, that would be the place.
Thank you. I know there have been some efforts to to disinfect masks and reuse them, really directed at the fact that there are shortages. But perhaps some of the technology and the research that's being done on whether we can effectively do that can be used going forward. And so we'll learn to green our hospitals too. Although of course worker safety is first in this case.
Well, there's a lot of work going on, led again by Healthcare Without Harm, on how to green our health sector, because the US hospitals, because they're so energy intensive and so waste producing, actually produce almost 10% of the greenhouse gas emissions in the US, including some of the very super climate polluting anesthetic gases that are used that have a very high global warming potential. However, I completely agree with you. It would be great if we learned some lessons about how to reduce waste, but I also think it's really, really criminal that we're putting healthcare workers and grocery store workers and others so much at risk to save lives by not having the kind of protective equipment that's required. And I really hope we can fix that problem quickly.
Yes, I think everyone here and watching agrees. Pope Francis has said that the pandemic could be nature's response to the climate crisis. What do you think about that? Do you see the pandemic as linked to the climate emergency in that kind of causal way? Do you think in general that the disruption of ecosystems makes epidemics possibly more likely in the future?
Well, we don't have full information yet on COVID-19, but we do know that there are ways in which our overexploitation of the Earth's resources and the resulting disruption of ecosystems are related to the emergence of these novel infectious agents that cause pandemics like COVID-19. And there's emerging evidence that COVID-19, in fact, came from people having contact with wild animals in a wildlife market in China. So we also know that deforestation is a big contributor to the climate crisis, and deforestation brings people and wild animals into closer contact. We also know that the expansion of human settlements into previously pristine environments brings people and wild animals into closer contact. And one of the reasons that people move into that closer contact is due to pressure from the diminished food and water access that's often caused by drought or other climate-related impacts. Climate change is warming the oceans and diminishing access of people to nutrition from the sea. And that's just another example of the way in which climate change interacts with overfishing to create the collapse of marine ecosystems. So, I think the most important lesson from this is that humans we're dependent on our environment. We can't be healthy if we don't have clean air and clean water and healthy soils to grow food and a stable climate. And when we mistreat the environment, whether it's deforestation or pumping carbon pollution into the atmosphere, in the end, we're just harming ourselves. And in fact, even more, we're harming our grandchildren and diminishing their opportunities to have access to healthy resources and the air, water, soil that they need to be healthy in their futures.
I'm glad you brought that up, because I think the idea of intergenerational justice, the justice, what we owe to the generations to come, is a key component of discussions about the climate crisis, and is something that our systems, our economic system, our government system is not well equipped to address. And so it's something that we need to keep reminding ourselves of. So thank you for that. As you know, the pandemic has resulted in some very swift changes in our daily lives in order to combat its spread. I'm currently, we're basically on lockdown here in Michigan. I'm a farm owner, and I'm very keenly aware of how extreme weather is affecting our ability to raise food in this country, from extreme rain events to flooded fields to increased diseases affecting our crops because of humid air. And in fact, for 3 years in a row, extreme weather has meant that 40 acres of my 80-acre farm has produced no crops.
Wow.
So what sorts of changes are we already seeing or about to see in our daily lives as a result of the climate crisis?
Well, I think we've mentioned most of them. You're talking about not being able to grow food in a half of your farm. I just read this week that the US Southwest is in a mega drought. It's the worst drought in many, many centuries. And we know that historically it was probably a mega drought that led a large population to leave that area. We're seeing these super intense wildfires. I mean, the firefighters here say that basically we don't have a fire season anymore in California. And those are causing these smoke plumes that have made, thousands of kids stay out of school for a different reason than they're staying out of school now. East Africa is seeing the worst infestation of locusts that they've seen in many decades. And here in the East Coast, there's communities that are seeing the worst tick infestations they've ever seen. I mean, I've read about parents that really are scared to let their children go and play outside in the summer because they're afraid of getting Lyme disease. In Miami, people are already seeing sunny day flooding in many areas, and there's knock-on effects to all of this. So, there's a lot of concerns that that African American and Latinx communities that have been not close to the ocean, have been higher up in Miami, are being displaced. It's sort of like climate gentrification. So each of these individual impacts has these ripple effects that we're all experiencing, even if we're not really aware of them as being climate related.
Absolutely. Thank you for joining us this evening. If you're just, I don't want to say tuning in on Facebook, but if you're just joining us, I'm Michelle Deatrick, Chair and founder of the DNC Environmental and Climate Crisis Council. And here with me this evening is Dr. Linda Rudolph, a public health expert who is also serving on the platform committee as our vice chair of the platform committee for the DNC Environment and Climate Crisis Council. Thank you for joining us this evening. We have a question from Harry. He says, would Dr. Rudolph please explain what climate health is and how it may more commonly be referred to in day-to-day life? To the extent that the term is helpful, could you unpack its value in talking about climate and climate communication and messaging?
Well, Usually talk about climate, health, and equity as kind of an interconnected set of issues. And when we talk about climate health, I think people are referring to a climate that resembles the one on which human beings have evolved. So we now have levels of carbon dioxide in the atmosphere that we haven't seen probably in a couple of million years. And humans only started to evolve a couple of 100,000 years ago. So we're not living on a planet that's like the one in which we evolved. And that's one of the big reasons for concern, is that, you know, those changes are disrupting our air, our water, our ocean currents, the temperature of the ocean. And we human beings learned how to live on this planet in a different time. And so we're seeing these disruptions where temperatures are making animals move into different elevations. They're making mosquitoes move into different elevations and exposing people to mosquitoes, to mosquito-borne, to malaria that never had exposure to it before. So all of these things are interrelated. And when I think about the interrelations, I sort of, for me, it's like you can't have healthy people if you don't have healthy places. And you can't have healthy places unless you have a healthy planet. And that's why the issues are so intertwined. And the good thing about that is that if we address the climate crisis, we will have healthier places to live in, and will improve our health at the same time.
Win-win. Yeah, and we can, it's part of valuing nature as a good in and of itself, as well as valuing our lives and those of the people to come after us. We've been talking a lot about similarities between the pandemic and the climate crisis, but one of the clearest differences is the timeline. The coronavirus was a global threat within weeks or months of its first appearance, we think, while climate crisis has been building for decades. We're in fact in the middle of it. And I think it makes it harder to sometimes for people to feel just how grave the emergency is. The urgency of the pandemic was clear to most people very quickly, but nevertheless, communicating about the urgency has been key to a successful response. What do you think's been most successful in the outreach about the pandemic, and can we use that to help communicate the urgency of the climate crisis?
I think that you're absolutely right, that the difference in timeline has made a big difference. And you know, it feels very acute. And it's easy for people to say, you know, actually early on, we did have people, including some of our national leaders, saying, oh, this is just like the flu. And it's easy. And of course, the scientists and the health experts were telling us, no, it's not. It's not like the flu. It has a higher fatality rate. Nobody has had exposure to it before, so we're all at risk. We don't have a vaccine for it. And it took a little while for that message to penetrate. But when we started seeing hospitals being overwhelmed so acutely, I think it really made an impact on people. I think it's easy for people to sort of say, oh, you know, we've always had extreme weather events. We've always had heat waves. And in fact, what the scientists are telling us is, no, we haven't had them like this. We haven't had such extreme weather events. We haven't, you know, yes, historically we've had mega droughts, but we haven't had drought after drought. We haven't had extreme hurricane after extreme hurricane. These events are happening more frequently and with greater severity and more force than they have before. I would say a really important difference about the communication is that even though there's been some early denial of the magnitude of the COVID problem, there's been climate denial for many, many decades. And the fossil fuel industry has intentionally sown doubt about the science behind climate change and intentionally misled the public and obfuscated the truth. And with COVID, we don't have an industry that's pouring very large sums of money into trying to persuade people that there isn't a scientific consensus about the urgency of climate action, even though, you know, well over 97% of the world's scientists are telling us, folks, the facts are clear. This is a crisis and we need to act. That's one of the reasons why the health community is calling on government to inform the American people that climate change is also a true health emergency, and that only urgent and robust action will forestall really devastating consequences, not just on our health, but on the health of our children and future generations. We really need government to tell the truth on this.
We absolutely do. And to counter, it'd be lovely to see the fossil fuel industry pony up the money to counter their own disinformation campaign for 40 plus years on this issue, along with other recompense that it would behoove them to make. But we have a question from Rosemary from Michigan, right here in my own state. How do you see these issues that are being discussed being integrated into the Democratic Party platform? And Linda, I'll let you go ahead and answer that. We've been working together on advocating for exactly that. So I love the question.
Well, you should also answer, Michelle. I'll start and you can chime in. From my perspective,
yeah, go ahead.
Well, from my perspective, the first thing we really need to see in the platform is a statement of intent and urgency, recognition that we have to act with urgency and an intent not only to act with urgency, but to act with sufficient robustness of response that we can get a grip on the magnitude of the problem that we've got. And that means really transforming the systems that are producing climate pollution and damaging our climate, our environment, and our health. We need to have clean, renewable energy. For our homes, for our buses, for our trains. We need a transportation system that allows people to walk and bike and use public transit so that we put physical activity back into our daily lives. Kids need to walk to school like they did a long time ago when I was a kid. We need an agricultural system that is not based on fossil fuel inputs, that doesn't contaminate our water, that is regenerative in terms of creating healthy soils, and most importantly, that allows everyone in the US to have access to healthy, affordable, plant-based diets, because we know that too much meat consumption, which is associated with a lot of methane production, and soil and water contamination, is also not good for our health. And we need to create healthy cities in which every person in every community has access to parks and green space and tree canopy, as well as access to clean and safe drinking water. So all those, and finally, we need the health care and public health systems to have the capacity and the resources to respond. So that's my wish list.
Yeah, I'm in vehement agreement, as you might guess, with all of those policy proposals, and they absolutely need to happen. And a large part of the reason that the DNC Council on Environment and Climate Crisis was founded not even a year ago, last August, at a DNC convention in San Francisco, was in fact to promote that the National Democratic Party would have bold, ambitious environmental, climate, and where it's intersectional with health issues, as it is almost everywhere, health policy. And we have several goals as a council, but the one that we're working on hardest right now is, in fact, to advocate for these kinds of policies that Dr. Rudolph is talking about to be included in the 2020 Democratic Party platform. The Democratic Party creates a new platform every 4 years in conjunction with the nominating convention for the Democratic Party's presidential nominee. That convention has been put off because, in fact, of the COVID-19 pandemic to late August this time. Perhaps it'll be in person, perhaps it will be historically virtual. We don't know yet. But we want to, as a council, and Dr. Rudolph has been working very hard with me and the other members of the platform committee, a group of 12 diverse, inclusive, and very passionate activists, experts, and scientists to ensure that we put forward a bold, ambitious proposal for the environment and climate plank of that platform. So we will be launching our recommendations in mid-May and advocating for them. And that's how the process of getting them integrated into the Democratic Party platform is making people aware of what needs to happen, of the policies that we need. And I think really carrying this message of urgency that Dr. Rudolph has been so excellent at conveying, that we just don't have time left. As Greta Thunberg says, the house is on fire, the planet's on fire. We've already invested, and we, meaning we humans, have invested enough in fossil fuel that's in the ground that if we develop all of it, we already will be blasting way past the Paris Climate Accord. So I would like to ask if Dr. Rudolph, one last question, and I think you have answered this in some ways, but I'll give you another chance, especially for people who have joined us later on. We see people in local and state and national governments worldwide working together with some success to battle COVID-19. It's good to look, as Mr. Rogers used to say, for the helpers. Does this give you hope that we'll successfully fight the climate crisis?
It gives me hope. It does give me hope. To me, it's a remarkable demonstration that, when we see the facts in front of us and we understand the urgency of action, and we all come together across geographical boundaries and cultural boundaries and racial boundaries, that when everybody comes together to address an emergency, we can do things that we never thought were possible. Not that I'm suggesting that everything that we're doing right now is feels great or has its own adverse consequences. I think that's one of the important things about climate change, that all the solutions we've been talking about for climate change, if we do them thoughtfully, if we have a just transition so we don't leave people behind, all of the climate solutions we're talking about are going to be good for us. They're going to create healthier communities and healthier people. Our kids will be healthier than they are now if we make these transformations that will address climate change. And it's not that we don't know how to do them. It's just that we don't have the political and social will that's required to make these changes. So that's what's a lesson in COVID, that if we can create the political and social will, we can do amazing things together. And my hope is that we will take climate change as seriously as we are taking COVID, in order to protect our health and the health of our children. My vision is healthy people, healthy places, and a healthy planet, and we can do it.
We can. We absolutely can. It's a gut-wrenching time that we're living through. There's grief, there are avoidable illnesses, avoidable deaths, but also that hope, the acts of courage and persistence and heroism and people coming together and recognizing how urgent the situation is. We are going to get through the coronavirus crisis. And the major question we've been thinking about tonight is, what kind of country are we going to be on the other side? Will we have learned and apply what we're learning from the coronavirus situation to the increasing, completely unconscionable levels of inequity in this country, of inequitable access to healthcare? Will we create a just transition? That is, will we ensure that the necessary transition away from fossil fuel, we make sure that those workers and other workers impacted by the climate crisis get good paying union jobs, and that we rebuild the middle class in this country? Will we make the necessary changes and ensure that everyone has access to healthcare as in every other, highly industrialized country in the world? And will we make the other changes that we need to our social safety net? So Dr. Rudolph has spoken. Thank you so much, very eloquently. And I know she has a very, very busy day and busy days in front of her. I am so grateful to her for being with us tonight and for serving on the platform committee of the DNC Council on Environment and the Climate Crisis. Thank you to our audience. I would ask you to please stay connected with the DNC Council's work. We're going to need you. We're going to need your support, your voices, your advocacy, and your input. To stay connected with us, like our Facebook page, you're already there. And also, please go to dncclimate.org and you can sign up for our email list. Dr. Rudolph, do you have any final words?
No, I just want to thank you, Michelle, for all the work that you're doing on the Climate Crisis Council and for hosting this event.
Oh,
it was really fun to talk with you.
I was so lucky to get to spend time with you. Thank you so much. And all of you, hoping that you and all of us stay safe, and good night. Thank you.